It takes a pretty big team to stay healthy throughout your life. Most of these we know. But what is an OMS? OMS stands for Oral and Maxillofacial Surgeon. We need OMSs to treat dental and medical conditions affecting the face, mouth, and jaw, and performing other complex oral and maxillofacial surgeries. Visit myoms.org to learn about the conditions they treat, the procedures they offer, and why OMSs are the experts in face, mouth, and jaw surgery. It takes a pretty big team to stay healthy throughout your life. Most of these we know. But what is an OMS? OMS stands for Oral and Maxillofacial Surgeon. We need OMSs to treat dental and medical conditions affecting the face, mouth, and jaw, and performing other complex oral and maxillofacial surgeries. Visit myoms.org to learn about the conditions they treat, the procedures they offer, and why OMSs are the experts in face, mouth, and jaw surgery.
Ya se cargó el disco y ahora lo primero que hay que hacer es la orientación. Entonces, interesa que lo que hago yo lo miramos por el lado derecho, ahí tenemos los dos malares, ahí se voy a
I went to an oral surgeon.
My facial surgeon did a great job.
I had to see an oral and facial surgeon.
My dentist sent me to an oral and Maximus.
Maximus.
An oral and maximilio surgeon, or something like that.
Officially, we're called oral and maxillofacial surgeons, and we're the experts in face, mouth, and jaw surgery. Members of the American Association of Oral and Maxillofacial Surgeons are trained and experienced in all these treatment areas. Our work saves lives, changes lives, and makes lives better.
I'm not sure what to call him exactly. I just know he did a great job with my dental implants.
She cured my sleep apnea.
He fixed my recessive jaw.
Diagnosed my oral cancer in time to beat it.
Took out my impacted wisdom teeth.
What you call us isn't really important, but when you're concerned about health issues related to your face, mouth, or jaw, just make sure you call us.
Why does everyone have such a hard time saying oral and maxillofacial surgeon? Really?
Pero primero le agrego la base de datos, Snapchat, Save to Dolphin Layout a la base de datos. Y acá me va a decir panorámica, ahí está, tengo grabado. Y hay que grabar en la base de datos. Pero además puedo exportarla como una imagen. Entonces por la derecha, Save, Export, This. Y acá lo voy a hacer.
Orbitali. PT point. Sella. Nasion. Basion. Point. Point. Soft tissue glabella. Soft tissue nasion. Bridge of nose. Tip of nose. Subnasally. Soft tissue A point. Upper lip. Stomion Stomion inferius. Lower lip. Soft tissue B point. Soft tissue pagonion. Soft tissue net. Soft tissue menton. Throat point. B point. Pagonion. Anatomical nathion. Menton. Gonion. Ramus point. Mid-ramus. Articulari. Condylion. A point. ANS. PNS. Upper 6 occlusal. Lower 6 occlusal. Distal upper 6. Mesial upper 6. Distal lower 6. Mesial lower 6. Point. Point. Lower incisor labial gingival border. Lower incisal tip. Lower incisal root apex. Lower incisal lingual gingival border. Upper incisal labial gingival border. Upper incisal tip. Upper incisal root apex. Upper incisal lingual gingival border. That's all. Point. point,
I went to an oral surgeon.
My facial surgeon did a great job.
I had to see an oral and facial surgeon.
My dentist sent me to an oral and maximal.
Maximus.
Maximus.
An oral and maxillary surgeon, or something like that.
Officially, we're called oral and maxillofacial surgeons, and we're the experts in face, mouth, and jaw surgery. Members of the American Association of Oral and Maxillofacial Surgeons are trained and experienced in all these treatment areas. Our work saves lives, changes lives, and makes lives better.
I'm not sure what to call him exactly. I just know he did a great job with my dental implants.
She cured my sleep apnea.
He fixed my recessive jaw.
Diagnosed my oral cancer in time to beat it.
Took out my impacted wisdom teeth.
What you call us isn't really important, but when you're concerned about health issues related to your face, mouth, or jaw, just make sure you call us.
Why does everyone have such a hard time saying oral and maxillofacial surgeon? Really?
It takes a pretty big team to stay healthy throughout your life. Most of these we know, but what is an OMS? OMS stands for Oral and Maxillofacial Surgeon. We need OMSs to treat dental and medical conditions affecting the face, mouth, and jaw, and performing other complex oral and maxillofacial surgeries. Visit myoms.org to learn about the conditions they treat, the procedures they offer, and why OMSs are the experts in face, mouth, and jaw surgery. It takes a pretty big team to stay healthy throughout your life. Most of these we know, but what is an OMS? OMS stands for Oral and Maxillofacial Surgeon. We need OMSs to treat dental and medical conditions affecting the face, mouth, and jaw, and performing other complex oral and maxillofacial surgeries. Visit myoms.org to learn about the conditions they treat, the procedures they offer, and why OMSs are the experts in face, mouth, and jaw surgery.
Maybe you don't know much about oral and facial surgeons. Even other dental healthcare professionals can be unaware of all we can do. So we're making it easier to get to know us and the patients we've helped through oral surgery. Our new website has all kinds of great information. You can see what's involved in various oral and facial surgery procedures. Just click on one of our ads on your favorite websites, or when you look us up on Google. We're also talking to your family dentist so he or she can better advise you about your work.
I would say to that oral surgeon today, thank you. Thank you so much for helping me understand about my own personal health and self-care. Thank you.
Get to know us. We're here to help.
Obstructive sleep apnea may sound like snoring, but it can also sound like a car crash. Those suffering from sleep apnea are 7 times more likely to be involved in or cause a fatal car accident, 20 times more likely to suffer from high blood pressure, 8 times more likely to suffer a stroke, and 10 times more likely to suffer a heart attack in their sleep. While it may only sound like snoring, sleep apnea is a serious and even life-threatening condition. But it can be successfully treated. Consult with an oral and facial surgeon as part of a sleep medicine team to find out if your snoring is more than just snoring. Oral and facial surgeons are the experts in face, mouth, and jaw surgery. Learn more about obstructive sleep apnea at myoms.org.
We're heading down the road and a truck, semi-tractor trailer merged into our lane and we had nowhere to go. My jaw hit the window and then my other side of the jaw, on the other side, hit the steering wheel. I couldn't eat, I couldn't open my mouth. The pain was terrible. And when I did try to force my mouth open, it would click so bad, the pain was it was awful. I went to my primary first. He said that I need to go see a dentist. So I went to see a dentist and they set me up with a OMS.
Bill came to see me for a consultation for pain in his joints. He had previously been involved in a motor vehicle collision. He came in with problems being not able to open his mouth fully. He was only able to open about 2 centimeters or 20 millimeters. He was having pain on both sides of his joints, both of his temporomandibular joints. It was really altering his life and his ability to eat the type of foods that he wanted. And the pain at rest was also kind of interfering with his daily function as well.
There's nothing worse than your teeth not lining up, the pain, not being able to eat what you want to eat.
There are many options for the treatment for temporomandibular joint disorders. We typically try to start with the conservative therapy or medical therapy. So we start with putting patients on anti-inflammatory drugs to get rid of the inflammation, muscle relaxants if there's a muscular component, fabricating a occlusal stent or splint therapy. Our main priority was to get him out of pain or reduce the pain as much as possible.
Well, first they did a flushing of both joints, and the one on the left seemed to have done the job, but the right, it had to be done another 2 times, and then that still wasn't sufficient. So then they went ahead and did surgery.
He had aggressive jaw stretching exercises afterwards, and that has worked for Bill, and he's done really well.
Out of all the different doctors that I have had to deal with due to this motor vehicle accident, OMS were the best.
Pain or no pain, your wisdom teeth should be checked every year. Some wisdom teeth can become impacted, which can lead to cysts, tooth decay, and gum disease. Wisdom teeth can cause crowding, painfully damaging adjacent teeth. Not all wisdom teeth need to be removed, but they all do need to be monitored by an oral and maxillofacial surgeon. Find a surgeon near you for a complete examination at myoms.org.
Wisdom teeth, or third molars, are the last teeth to develop and enter your mouth. If wisdom teeth come into the mouth in a proper position and meet certain conditions, it's generally accepted that you can keep them. However, they're still prone to disease, even if you experience no pain and have no symptoms. This is why the American Association of Oral and Maxillofacial Surgeons strongly recommends that third molars be evaluated annually from the time a patient is a young adult. Studies have shown that about 9 out of 10 people have at least one wisdom tooth that can't break through the gums in an upright, functional position. As we say, it becomes impacted. If left alone, an impacted tooth can become infected or damage neighboring teeth. That can lead to gum disease and even the formation of cysts or tumors. By the time you feel pain or notice that something is wrong, it may be too late to prevent the problem. An estimated 35 million Americans have sleep-related breathing problems. Common symptoms include daytime drowsiness, snoring with pauses in breathing, often observed by a bed partner, gasping or choking during sleep, restless sleep, a problem with mental functions, poor judgment or lack of focus, memory loss, being quick to anger, high blood pressure, nighttime chest pain, depression, morning headaches, reduced libido or impotence, and frequent trips to the bathroom at night. If you have 2 or more of these symptoms, or if someone has mentioned your loud snoring and notice that you often wake up abruptly, gasping for air, see your physician. Depending on the severity of your condition, treatments may include behavior modification or simple lifestyle changes such as weight loss or a change of sleeping position. Oral appliances that bring the jaw forward during sleep to keep your airway open. CPAP or BiPAP devices that use positive air pressure to keep the airway open during sleep. Or surgery. If devices or oral appliances are ineffective, surgical treatments may be indicated. Your oral and facial surgeon will work closely with your sleep medicine physician to determine the best treatment for you. As a result, sleep is improved. Obstructive sleep apnea is a serious condition, but it is treatable. Your oral and facial surgeon is ready to help as an integral part of a professional team that treats sleep-related breathing disorders. Corrective jaw surgery is also known as ortognátic surgery. It's performed by oral and facial surgeons to realign jaws and teeth and to improve basic functions like chewing, speaking, and breathing. An orthodontist can correct a patient's bite if only the teeth are misaligned. However, corrective jaw surgery performed by an oral and facial surgeon may be necessary to correct a misalignment of the jaws. This can be caused by birth defects, injuries to the face and jaw, or because the upper and lower jaw grew at different rates. One type of ortognátic surgery, called maxillomandibular advancement, or MMA, is used to treat obstructive sleep apnea. The oral and facial surgeon surgically repositions the patient's upper and lower jaws to prevent the tongue and other soft tissues from blocking the airway during sleep. The success rate for MMA is close to 90%. All types of corrective jaw surgery are performed under a general anesthetic in a hospital, an ambulatory surgical center, or in the oral and facial surgeon's office operating suite. The procedure may take up to several hours to complete. Depending on your condition, you may be able to go home the same day, or be required to stay in the hospital for 1 or 2 days. Patients are generally able to return to work or school 1 to 3 weeks after surgery, depending on how they feel. Complete healing of the jaws takes between 9 and 12 months, with additional time required for your orthodontist to fine-tune your bite. Corrective jaw surgery requires a long-term commitment from you and your family. The surgery is only part of a process that usually includes orthodontics before and after surgery. Your oral and facial surgeon, orthodontist, and family dentist will work as a team to estimate how long the entire process will take. After the process is completed, your jaws and teeth will be in positions that are more balanced, functional, and healthy. The goal is to improve your bite and function. Yet some patients also experience positive changes in their appearance and speech. Corrective jaw surgery can have a dramatic and positive effect on many aspects of your life. Talk to an oral and facial surgeon and find out if it's right for you.
My name is Tatiana.
Oh, my name is Rafael.
My name is Suzette. When I was a child, I had a fairly sizable overbite.
I guess it was age 13, around 13, that I noticed that something was wrong. As I began to grow, I had an overbite that just kept getting bigger and bigger.
It was definitely noticeable visibly. I could fit like a couple fingers in between my front teeth.
Definitely looking in the mirror, I noticed physically that I had an overbite. Everyone did as I grew up. The grammar school kids, you know, we kind of make fun of each other with anything that we can physically. The joke for me was always something that had to do with my teeth or my mouth. It got worse and it made me more self-conscious.
It affected the way I chewed and my bite, and I started getting a little bit of TMJ.
I didn't know there was something medically wrong with me. In the beginning, it was mostly these things where I noticed, oh, eating is a little bit harder, speaking is a little bit harder, I look kind of different.
I found myself waking up a lot in the middle of the night, and I really didn't know why. And my mom said, boy, you know, that's a really bad snore you have going on there. I think we should go see someone. I would have never imagined that an overbite could create a snoring problem.
My brother is an orthodontist, but he wasn't an orthodontist when I was 13. He was in school. He knew I'd been complaining about it for a very long time, and you know, once he got out of school and started practicing as an orthodontist, he said to me, you know, if you really want to fix this, I think you should do corrective jaw surgery.
So after wearing my braces for a while, my orthodontist sat me and my parents down, and then we were referred to an oral surgeon for corrective jaw surgery.
My orthodontist finally recommended oral surgery.
I met the surgeon and I loved him. It was one of those moments where you meet somebody and you just can feel that connection. I just felt like he understood me.
I was relieved that he seemed to know exactly what to do. He was the first medical professional that I'd met with about this that had a very clear and definitive treatment for my problem.
Well, when I met with my oral surgeon, I was scared. You know, I didn't know what to expect, and he took a lot of my fears away by telling me how much my life could change and will change with the surgery.
It gave me so much confidence to walk into a room and feel like, you know, this is the best me. I'm normal. I'm like everybody else. I don't care if you're looking at my chin. I hope you are looking at my chin because it looks great.
Well, physically, it definitely helped me look better. I definitely looked in the mirror a lot. I think it was at a time in my life where it was important for me to look good and, you know, made me feel better.
The results were noticeable right away. I didn't realize how much I'd been suffering. I knew that I looked different and I really liked the way I looked, but I didn't realize how much it was affecting even the way I talked and the way I chewed my food.
Before, I would be very self-conscious when I was eating. Afterwards, there was just such an ease to it. I could eat whatever I wanted and I didn't care. Like, I could take a big bite into a burger and just tear into it and not have to worry.
I had more confidence. I feel better. I look better.
I've had no pain, no, the TMJ, the clicking in my jaw went away completely. I couldn't be happier with the results.
If someone said to me, I think I need corrective jaw surgery, what should I do? I would say, make an appointment with your oral surgeon, go, see if it's the right path for you, and do it. Absolutely do it.
I would definitely tell anyone who's thinking of corrective jaw surgery to at least go speak to their oral surgeon. I'm sure that, like mine, they'll treat them very nicely and will make them feel comfortable, at ease, which is kind of the first big step.
Just don't wait. Just don't put it off, because it's changed my life. It's really worth it.
You know, you'll be happier. I promise you'll be happier in the end.
Corrective jaw surgery absolutely changed my life. Looking good, feeling good, you know, I credit all that to my oral surgeon.
I couldn't be happier that I had the procedure done. I was very fortunate to have been recommended to a wonderful oral surgeon.